Yes, hello friends. Today, as you can see, that right now I'm in Australia, and here I am for the tourist purpose also, and meeting with my patients also. So, as I have meet with my lot of patients here, and as I can observe that there is a lot of difference in the culture, in the environment, and the climate related factors are there, and even the prakriti which we discuss in the Ayurveda, Vat prakriti, Pit prakriti, and Kaf prakriti, that is also totally different. These types, actually, the climate is different, and the procedure which we usually discuss in the Ayurveda, which is Adan Kal and Visar Kal, that is also different in this country because the weather is totally different. Right now, here is winter season, and in our country, in India, it is the summer season. So the procedure Adan Kal or Visarj Kal, which is recommended in Ayurveda, that is also different in this country, and even the nature of the patients, especially they mostly the Australians are in the Pit Prakriti. Pit and Vat, two types of the Prakritis are there, which I have observed in this. So the basic thing is that, as you know, that our channel is basically is on the AVN, Avascular Necrosis. Even a lot of patients are suffering with this disease, not only in India but all over the world. They are suffering. So as I can observe, the weather is totally different. That's why the pain is too much here in the lots of patients, as they have discussed with me. So from the beginning, this video is for those patients who are not able to understand the Hindi, because most of my videos are in Hindi, and it is very difficult for those patients who are not able to understand the Hindi, and especially for the foreigner patient. So I decided to make this video for especially for the foreigners patients. Okay, who can understand the English. Okay, so from the starting, as you know, the AVN, avascular necrosis, is a disease in which the obstruction in the blood supply is there. Okay, so the why obstruction is this? First of all, the question is that why the obstruction in the blood supply happens. So let's start. So the reason behind the AVN is the steroid. As you know that in after the COVID, the most of the patient have already taken a lot of steroids for to fight against the COVID. Not only the COVID, but in some disease like dengue, malaria, and sometimes in the skin disease, a lot of patients have already used the steroid. In Australia, they have banned the steroids, and as I can observe that they have even banned the packed water or any packed things. They use generally tap water. Okay, so due to the excessive use of the steroid in the COVID as well as in the skin disease, the AVN occurs. Okay, so the basic thing is that once the obstruction is happen, then the blood supply of the particular hip joint is obstructed, and the hip joint become dead. Slowly, it become dead. As you have already seen in my videos, it has four grades: one first grade, second grade, third grade, and fourth grade. Initially, one, two, three grades are not observable in the X-rays, but they can observable in the MRIs also. But once it goes to the fourth grade, it can be easily identified in the X-rays as well as in the MRI. Okay, so and a lot of pain is there. Okay, so in fourth grade it is easily observable in the fourth grade, and most of the patients came to know about their AVN only in the fourth grade. Even 90% patients only know about their AVN in the fourth grade. Okay, rest of the time their body manages their pain, and sometimes patient itself manage their pain, that they may be suffering with the sciatica or any other disease. That's why it happens. Okay, so the basic thing is that once you have the information that you are suffering with the AVN, so don't worry about that you are suffering with the AVN. Don't get too much panic. Okay, the basic thing which I want to tell you to the foreigner patients, don't get too much panic and try to understand the disease. Okay, so this at the initial stage, this is the main time which you have to understand the disease, and which you have at that time which you have to follow the some important points related to the precautions. Okay, so the thing is that you have to follow some important points, like you have to avoid bike riding, stairs climbing, and sitting below the knee level. Okay, because in the bike riding, when you put your leg like this in the cross position in any bike, in that condition the femur head will get damaged. Okay, And if you do the too much stairs climbing without the support of the any railing, in that condition the pressure is in your femur head, and it it can cause the damage. Okay. And if you sit below the knee level, that means and at the point of which at which height your knee comes, you need not to sit below the knee level. So when you sit below the knee level, at that condition, your femur head movement is too much, and at that time, the femur head, the chances of the femur head damage is too much. So the important thing is that you have to avoid the precautions. Okay, you can see in the display also, and any patients who are the foreigner, they can contact me on my WhatsApp number. My WhatsApp number is already displaying in this video. That is 97007 plus 91 is actually the country code, and the phone number is 7007 968 664. Okay, you can contact me on this number. The basic thing is, so as I talking with you, the basic thing is the first you have to follow the precautions. Okay, you, as you know about the AVN, you have to follow the precautions, and then uh, you have to do the exercise. Second point is you have to do the exercise, regular exercise. As you see in my videos, I have made this exercise very simple so that everyone can understand the basic thing about the exercises. Okay, there are only the four types of the exercise. Two types of the exercise you have to follow in the front side, and two exercise you have to follow in the back side. Okay, and rest of all, if you have any query, if you have any problem or related to the pain, suppose there is a pain in the front of the thigh, suppose there is a pain in the back of the thigh, suppose there is a pain in the lateral side of your legs, in that condition there are some different exercise which I will tell you when you will be in contact with me on my WhatsApp number. I will send you the links. Okay. So the first point is the precaution, second point is the exercise, and third point is the medications. Okay, as most of the doctors tells that it is not possible to improve the blood supply of the femur head. Okay, the thing is that it is possible with the means of the two things. If you increase the demand of the blood in your particular portion, that with the help of the exercise, in that condition there is a good chances of increase in the new channels or collaterals in your that particular body part. Okay, so if you do the regular exercise, there is a good chances of the increase in the blood supply, and if you properly take the medications, especially the Ayurvedic medications, which I used to recommend to the people, they work on the blood. They reduces the sticky nature of the blood. They reduces the toxins from the blood. Okay, and with the help of the medicines and exercise, we can improve the improve the blood supply. And if you properly uh, follow the therapy sessions which we used to give in our centers, and as you know that we have done a lot of 5-day treatment plan in our India, from especially in Varangal, in Pune, in Bangalore, in Ahmedabad, in Delhi, we used to conduct several camps. Okay, so if you, and even you can come in the Kanpur is our main branch in India. Okay, if you can come in the Kanpur for the therapy sessions, that are very important, because the most of the things which you are not able to follow is the stretching exercise, which you cannot do in your home alone. So for that you need to come to contact with us, and you have to take the therapy sessions, because in the therapy sessions which we, not only the stretching, but we do the alignment of your joint also. Okay, alignment of the you can say the of the hip joint also, that is very important. So if you follow all these points, well, that means the if you properly follow the exercise, precautions, medicines, and the therapy sessions, then you will definitely get the result. So don't get panic, and just follow the my YouTube channel. You will get a lot of information. Now the last point and very important point is diet. Okay, as you have seen in my videos that I used to recommend the millets diets to the patients most of the times. Okay, millets diets diet means the multigrain diet, you can say. A lot of types of the millets are available in India and other countries also. So if you go to the millet side, that it will be very beneficial to you. And as you have seen in my several videos that we used to recommend a raw diet and water fasting also. That means that is also a natural diet. Okay, the human being is the only animal which use the cooked food. Okay, but God made us to eat the raw food which he had made in his kitchen, you can say. Okay, but we use our own kitchen and we cook the food. So better thing is that the try to take the foods which is made by God in its original form. That means it is in the raw form. It will be better for you. And water fasting, I used to recommend in my videos or several videos also. Water fasting is that the fasting in which you take only and only water for more than for a few days, 5 to 7 days. Okay, so the thing is that if you properly follow the raw diet and water fasting, in that condition, the toxins will be removed from your body, and you will get a lot of benefit with that. Okay, so these are the some important things which I want to discuss with you, and the I hope this video is very very helpful to you. And if you have any query, you can WhatsApp me on my WhatsApp number. That is +91 is the my country code. And after that, you have to dial 7007 968 664. You can dial on this number, and you can WhatsApp me your reports also, and you can WhatsApp me your queries also. And I get you revert with you, once I get give you the answer to you on the WhatsApp. After that, you can phone me or call me. Okay. Okay, friends, I think this video is very, very helpful to you. And stay tuned with us, our channel. My channel is Dr. Vijay Prakash Kanpur. You can search in the YouTube also, and just follow that channel. You will get a lot of information. I hope you like this video. Till then, namaskar.